Today we are going to talk about venous return in cardiac cycle and how it is affected by venodilator.
Veins are like balloons, and since the heart are pumping blood continuously, the amount of blood injected to the veins is fixed per unit of time. So for the fixed amount of blood, what is different in these veins are the degree of stretchability in their walls. Higher stretchability means higher compliance and less tension in the wall for the same amount of volume increase. And tension in these walls will determine the pressure inside the veins.
Let's give an example. Let's imagine that we have a syringe that's filled with a fluid and we're going to inject it into a balloon.
So the already filled balloon will increase in volume the same amount as the volume in the injection, and this will cause an increase in the tension in the wall, and that will cause an increase in the pressure.
Now imagine that we gave a venodilator to that balloon, so the stretchability of the wall of that balloon is increasing. Then we're giving the same amount of fluid that we gave through the first syringe to the same balloon.
The drug balloon will increase in volume the same amount as the first balloon, but the tension will increase to a lesser amount and the pressure will increase to a lesser amount too. The veins drains to the atrium, and the degree of flow depends on the pressure difference between the two sides. The filling period of the cardiac cycle is fixed regardless of how fast the blood is pouring into it. And since the flow depends on the pressure difference between the veins and the heart, the flow is lower in the drug balloon because of the less pressure difference. During the fixed filling period of the heart, the amount of the blood that's being available to the heart to pump out is less in the scenario of the drugged balloon compared to the first one.
Thus, we have less venous return, so you should understand that what's happening was less flow for a fixed time, which means less volume returning to the heart. And thank you for listening.